At Maverick Citizen reporting that the suspension of the Department of Health Director General Dr. Sandile Buthelezi and long-time Deputy Director General Dr. Anbai Pillay appear to be imminent as they face disciplinary inquiries. It's been sparked by the Special Investigating Unit's inquiry into the Digital Vibes scandal. Now it's believed that many other senior officials could well be suspended. Joining us for more on the story is the daily editor of Maverick Citizen, Mark Hayward. Mark, good evening to you, and thank you so much for your time tonight. Firstly, just looking at the story that you, of course, had published earlier on in the day, followed by the briefing that was given by the SIU to Parliament this afternoon, it very much looks like the net is closing in on a number of senior officials within the health department. But there have been a couple of snags along the way. What is the holdup in expediting this process from what you were able to see through your own investigations?
Good evening, Kathy. Yes, I mean, it seems as if the SIU has done a very, very thorough forensic investigation into the Digital Vibes contract. It's tracked down the payments, it's worked out who the payments have been made to, and it's worked out how that contract came about. And a lot of the SIU's findings are set out in an affidavit before the special tribunal, where the SIU is trying to have that contract declared unlawful and invalid and use that as the basis to recover the full 150 million rand that has been spent on this contract. But of course, when the SIU conducts any investigations, it is at the request due to a presidential proclamation. So it has to report to the president and it has to make recommendations to the president as to actions that should be taken against officials or ministers or others who may be implicated. So what I've managed to establish and had it confirmed with the presidency yesterday was that the SIU has sent referral letters, what are called referral letters to President Ramaphosa, and in those referral letters they recommend that there should be action against the current Director General of Health, as well as, I believe, the current Deputy Director General of Health, who was for 6 months of the period of Digital Vibes the acting Director General. But that's as much as we know, Kathy. It's really now for President Ramaphosa to indicate, and I think he owes it to the public, just what he is, first of all, to release this report, and secondly, to indicate what he intends to do with the recommendations that have been made by the SIU. It's
been sitting on his desk for at least 2 months as far as what we can go on in terms of what's available in the public record. That would seem like it's enough time for the president to be able to act on that SIU report. But of course, more and more we find out that what was contained in the report very much goes against perhaps the kind of farewell that the president had bid to the health minister.
Yes, well, again, we haven't seen the report. What we have seen is this affidavit before the special tribunal. And what that affidavit shows is that former Minister Zweli Mkhize's hand was very central to this Digital Vibes contract. In fact, I would go as far as to say that he was a facilitator. He was almost an architect. Certainly judging just by the legal papers. He began pushing for Tahira Mata and others to be contracted to the Department of Health within days of being appointed as minister. And there's correspondence with the former Director General and with others that shows that he had a direct hand in trying to make sure that this communications contract went to this particular group of people. And in fact, of course, this has all still to be tested in court. It must still be tested by the special tribunal. But in fact, the SIU in this affidavit says very, very categorically that the health minister acted unlawfully, that he acted unconstitutionally. I believe that it says that he acted fraudulently in the way that this contract was brought into being. So yes, it sheds a much clearer light on what's happened than what we heard before.
Mark, there's something interesting that I want you to also touch on. And, of course, with the recent killing of Babita Deokaran, it also jumps out immediately. The role of the CFO in the Department of Health at a national level, who has recently resigned. Why has this individual resigned, and what is their role in the case?
Well, clearly, a chief financial officer in any government department, any department, and it was the case in Gauteng, where Babita Deokaran was the acting chief financial officer, and also in the health department, sees all financial transactions that take place and is in a better position than almost anybody else to evaluate whether those transactions are legitimate or illegitimate. The health department's CFO has resigned, I believe just over a month ago. There's no evidence at all that he was involved in any financial misconduct or malfeasance. And from what I can see in the SIU's papers, he in fact assisted the SIU with their inquiries. But I don't know, the reasons for his departure. I would imagine that in this era of capture and corruption in many government departments, that people who sit in positions of authority over finances feel themselves to be very, very vulnerable, particularly if they do not have the support that they need from within their department. So it's a blow. And what I mentioned, Kathy, in the article is that I think all of these shenanigans leave the National Health Department stripped of senior leadership and capacity at a time when, as we all know, we're going through perhaps the greatest health challenge this country has ever faced.
Mark, just before I let you go, we also see coming up quite prominently in the investigation at a national level where PPE corruption tenders concerned, that whistleblowers have again been integral in the work that is being done by the SIU and with the kind of findings that are being made.
Yes, whistleblowers are the game changer. There's no doubt about it. This digital vibes, the SIU makes repeated reference. I have no idea. They've protected the person's confidentiality, who the whistleblower is. But it took the media, together with a whistleblower within the department, to make this issue public. And, Kathy, I talked to a lot of whistleblowers in the course of my work as a journalist and editor of Maverick Citizen, talking to people in the health department in Gauteng, in Johannesburg City Council. They play a critical role, but they're very fearful, I have to say, particularly after the murder of Babita Deokaran. They're seeing that as a signal, and people feel vulnerable, they feel afraid, and I think that President Ramaphosa and the cabinet needs to move very quickly beyond promises and lip services about the protection of whistleblowers to much more concrete action that will create better legal frameworks, better security, and better assistance to these people. Without whistleblowers, we wouldn't understand a fraction of the corruption that has been going on, that has literally been the theft of billions of rands from private companies and from government departments.
Mark Hayward is the editor of Maverick Citizen. Mark, thank you so much for your time tonight and for shedding light, even more light on that issue.